Consumer interest in how food animals are raised and antibiotic use along the way spurred regulatory change at the federal level.
If you're feeding a product that is deemed to be medically important to human health, then you will need a veterinary feed directive from your veterinarian to be able to use that in your feed grade antibiotic ration. What that means for producers is that they'll have to have a valid veterinary client-patient relationships.
The U.S. Food and Drug Administration had similar rules in place for almost 2 decades, but they've recently been overhauled. Corbin says it's like having a prescription for certain rations.
If I am a producer wanting to feed a feed-grade antibiotic that is covered under the VFD, the most important thing to remember is I need to have a veterinarian that understands my operation and how I handle my cattle in that operation. The other really important thing if I'm a producer looking at this coming down the turnpike is to help my veterinarian work with my nutritionist, whether that's a consulting nutritionist, whether that's the co-op down the road, or whoever serves in your nutritional capacity, to make sure that they work together to get the formulation correct, make sure that it's a legal combination.
There are still many clarifications that need to be made before the directive rules are implemented in January 2017.
The 3 things that you can do today, tomorrow, this week to get ready for all of this is talk to your vet. Determine which products you use that will fall under the veterinary feed directive. Second thing is talk to your nutritionist, whether that's a consultant, a co-op, whoever your nutritionist is, that you get your nutritional advice from and start working with him or her to determine how this is going to affect your operation. And then the third thing is to actually get those 2 people in a room with you and have the discussion now and get aligned to this is what we are going to do, this is what we are not going to do, and this is how we're going to handle it.
There will be time for details, from paperwork to drug labeling and classification. The most important thing for producers to do right now is begin communicating. I'm Bob Cervera.